Good evening, everyone. My name is Michelle Groman. I am the president and CEO of the Greenwall Foundation, where we seek to make bioethics integral to decisions in healthcare, policy, and research. I'm excited to welcome you to this year's William C. Stubing Memorial Lecture, Confronting the Public Health and Ethical Challenges of COVID-19. The Stubing Memorial Lecture, now in its 5th year, is intended to reach a broad public audience and show how ethics impacts our everyday lives. I can think of no topic that is so directly impacting so many of our lives than the one we will be exploring tonight. I also want to thank the NYU School of Global Public Health and Center for Bioethics for partnering with us for this event. We have an extraordinary evening ahead of us, but before we dive into the conversation, I have just a few housekeeping notes, which we'll drop in the chat as well. First, this event is closed captioned and will be recorded for those who are unable to join us this evening. Second, an audience Q&A session with our speakers will occur at the end of the lecture. If you have a question, please submit it via the Q&A box. Our moderator will pose a selection of these questions, as well as some of the questions that you submitted in advance. Third, we're excited to be live tweeting this lecture. You can join the conversation by using #Stubing2021. It's now my pleasure to pass the baton to the Greenwall Foundation's board chair, Dr. James Tulsky, who will share more about Bill Stubing's legacy and introduce tonight's moderator. Thank you.
Thank you, Michelle. I am delighted to add my welcome to this year's William C. Stubing Memorial Lecture. Bill Stubing served as the president of the Greenwall Foundation for more than 20 years and passed away 6 years ago. Under his leadership, the foundation grew to its current prominence in bioethics. Bill was a deep thinker with a big heart. He was intensely curious and loved to find connections between art and medicine, or theology and science. He was kind and generous, and more than anything else, he loved witty, smart, and thought-provoking dialogue. Although he carried himself with an almost quaint Victorian sensibility, Bill devoured radical ideas, regularly took risks, and as a funder, was quick to support controversial, important work from which others shied away. Under his oversight, the Greenwall Foundation was often among the first to support bioethics research on topics such as organ transplantation from non-heart-beating donors, the influence of big pharma, and genetic engineering. He also appreciated that what would drive forward the field of bioethics was a pipeline of talent. He oversaw the creation of an interdisciplinary bioethics fellowship program at Johns Hopkins and Georgetown, as well as the Greenwall Faculty Scholars Program, which remains our flagship investment. Graduates of these programs have become leaders in universities throughout the country and are among the most important voices in bioethics deliberation. The Greenwall Foundation's hope for the William Stubing Memorial Lecture is to model and promote vigorous and civil discourse on bioethics issues that might otherwise escape the public eye. We miss Bill tremendously. We are joined today by his husband and life partner, Ron Thomas, as well as his friends and family. It is now my honor to introduce our moderator, Dr. Sanjay Gupta. Dr. Gupta is the Chief Medical Correspondent for CNN. He plays an integral role in reporting on some of the most important health stories in the United States and around the world. In addition to his work for CNN, Dr. Gupta is an associate professor of neurosurgery at Emory University Hospital, and associate chief of neurosurgery at Grady Memorial Hospital, Atlanta. And I can say almost missed tonight because he was doing surgery, and we're glad that he's here. And in 2019, Dr. Gupta was elected to the National Academy of Medicine, considered one of the highest honors in the medical field. Dr. Gupta, we are thrilled to have you join us this evening, and I'll now turn over the webinar to you.
Thank you so much, Jim. Really appreciate that. And what an honor to be here and to help honor Dr. Stubing as well. I'm honored to welcome two people who have been a consistent, steady, and guiding hand throughout this entire pandemic. People that you know well, Dr. Christine Grady and Dr. Anthony Fauci. Dr. Grady is the chief of the Department of Bioethics at the National Institutes of Health Clinical Center. And Dr. Fauci, of course, is the director of the National Institute of Allergy and Infectious Diseases. I don't think there's any question in anybody's mind how much COVID-19 has challenged all of us all over the world. And yet the people that I'm about to introduce you to are people who have not only been champions of science, but have been a true moral compass, a true North Star, I think, for all of us as well, setting an example in the face of this once in a century pandemic. I should also add, for those of you that don't know, Doctors Fauci and Grady have the privilege of being each other's spouses as well. So not only have they helped all of us, they've helped keep each other sane as well. So thank you, both of you. Thanks for joining us.
Thank you very much.
You.
Thank you for that very kind introduction, Sanjay. It's a really great pleasure and a privilege to be here, but also to be interacting with you, since this is another example of the things that we've shared over this really very, very difficult time. And it's been value added for me to be associated with you. So thank you very much.
Well,
I wanted to thank the board and the leadership of the Greenwall Foundation for inviting us. I never had the opportunity to meet Bill Stubing, but everyone that I've ever known that knew him loved him. So he was an amazing guy. And we all owe him a lot of appreciation for all the work, the great work that Greenwall Foundation has done and that he got going. So thank you. And I also wanted to just say, it's pretty daunting to be here with Tony Fauci and Sanjay Gupta, names that every household knows by now, and then little old me in the middle. But one of these guys I know pretty well, and Dr. Gupta I've had the honor of meeting a few times since 2020. So it's quite an honor and a thrill for me to be here with you all.
Well, the feeling is entirely mutual, and we had a chance to take a walk together and spend some real time together, just chatting about, yes,
Right.
the pandemic, but about life overall as well. And I think about you guys a lot. I think about how you're doing and how you're holding up, and just the incredible schedule. So let me just start there. How are you doing, Dr. Fauci? I'll start with you.
Well, Sanjay, I'm doing fine, and as I've mentioned to you in our prior discussions, and I'll reiterate it for the audience, is that the enormity of the problem is such that despite the fact that it's been almost impossible with regard to the stress and the hours and the fact that I've been at this for now almost 20 months, and I haven't had a full day off in 20 months, but I don't say that to feel sorry for myself. It's just that you do what you need to do. I mean, this is what we've chosen. You and I have chosen a certain pathway in life, and in mine it is infectious diseases and public health. And these are the kind of things that rarely happen, that you have to respond to a historic pandemic. But when it happens, you just have to rise to the occasion. So yes, I'm fatigued. Yes, I'm stressed. But I got an incredible person here who sees me through it, thank goodness, as well as friends like you who've been encouraging me over the last couple of years and many, many years before that when we were doing HIV together. I'm fine. Bottom line is I'm fine.
That's good to hear. And Dr. Grady?
I'm fine too. I think, luckily we have each other. We can support each other through all this. I think the busyness is not something to ignore. We've all been incredibly busy and stressed. And, the world has been hit by something that's really devastated a lot of people, and, so many deaths and so much loss and so much tragedy. So it's just, keeping up with what we can contribute in our small ways is really important. And that's what we've been doing.
Well, before we get started with the formal questions, let me just say thank you again on behalf of the grateful world for all that you both have done. It's really, very much appreciated. Every time I get a chance to sit down and talk to you, I talk to my colleagues about these discussions ahead of time, and everyone asked me to pass on their well wishes. So there you go. Dr. Grady, one of the things that strikes me, I wanted to ask you in your position as an ethicist. So much of what we ask people to do when it comes to a pandemic like this and public health is not only do things for themselves, but do things for the collective, right? That's the appeal. Wear a mask to protect yourself, but do it so that you don't potentially spread the virus to others. Same could be said about the vaccines. how do you sort of approach that from an ethical standpoint? How do you make the case best to people that the collective should be equally or even more motivating?
Sure. I mean, there's a classic tension between public health and individual interests and freedoms, where there seems to be this conflict. The things that we do to protect the public health and to protect the population and for the common good, sometimes are perceived to be, and sometimes they do in small ways, infringe on people's freedoms. There are, principles of public health ethics that help you sort out, the kinds of interventions that we should use are things that are effective, that are proportional, where the benefits outweigh the risks, that are necessary, that are least infringement possible, that are transparent, that we can publicly justify. And, in the setting of a pandemic like we've been living through, we've needed public health measures to, as you just said, Dr. Gupta, not just protect ourselves, but to protect everybody around us and to really, promote the public health. The challenge has been that some people see those public health requests as more than a sort of minor infringement on their rights, on their freedoms. And actually, as we all know, some people deny that COVID is even real or that it's a problem. So what's so striking to me is that, the kinds of burdens that we've asked people to undertake, like putting on a mask, don't really infringe on one's freedoms very much. They're low burden and they have an effect. They do protect the person who's wearing the mask as well as the people that are around them. What's interesting too is that, sometimes you see the effect of people being able to understand that it's important to help others as well as themselves, even though there are deniers and, people who say it's my body, my choice. I'm not going to wear a mask. I was reading a survey recently that was a survey of people who were unvaccinated. And one of the messages that this particular survey said was the most effective was to tell people that if they got vaccinated, it would help their families and the people they love, the people that are near them. And that was like the most effective message. And I was like, well, that's the message we've been kind of using throughout this entire pandemic, and yet some people haven't heard it. So it's we've got to be clear that things that public health emergencies require in terms of helping all of us sometimes require a little bit of burden on the part of the individuals.
Yeah, and as you point out, I mean, it's not even that much of a burden, some of these things. I mean, I remember early on when there was this modeling study that came out of Columbia saying, basically, if you wore a mask when you went out in public, you could be part of a movement that could save, at that time, 40,000 lives. And, there was a significant percentage of people who, despite hearing that, despite being told, put 2 ear loops on when they go outside and they could be part of this movement, they would say, no, thanks. I'll pass. That was sort of shocking to me, to be honest. I guess I maybe was naive to rely on people's sort of most benevolent nature. Did it surprise you, Dr. Fauci? You've been doing this a long time. How has this been different, and how has it changed since January of 2020?
Well, it is different than anything I've seen before, Sanjay. I have never seen what I think would be almost an irrational pushing back and denial of what you just said, namely what important impact it would have on not only yourself, which people always say, well, let me worry about it, my body, my choice, but the fact that people wouldn't resonate with the positive effect that it would have on other people. And I've been, had the privilege, I guess, of having been through multiple outbreaks in my position over the last 40 years. And we often compare this with HIV. And yet, when you talk about what people want to do for others about getting out there and counseling people to be able to do things to protect themselves, it's entirely different. It's unique. And I think the uniqueness about it, Sanjay, if I'm not mistaken, I believe I am at least partially correct, that it has to do with the fundamental feeling of infringement on your own a right to make your own choice that has fortified by political connotations, where people want to not wear a mask, one, because they feel you're infringing on their own right to decide, but B, because it's divided into camps, and I'm in this camp and you're in that camp. I mean, all you need to do, we've been through this before, you look at the maps of the country with the red states and the blue states and look at who's wearing a mask and who's not, and who's getting vaccinated and who's not. So not only is it a pushback against a so-called mandate to do something like put a mask on or to get vaccinated, but it's also an expression of what camp you're in, which I think makes it even more complicated because it gets beyond the issue that Christine was talking about the ethical aspect of doing something that would help others. It's like, I'm not doing it for a number of reasons. One, I don't care if it helps others, but besides, I'm making a statement. And my statement is I'm not going to wear a mask and I'm not going to do this, which to me as a public health person is just so antithetical that everything that I know and feel passionately about public health is that that's not what public health is. It's kind of what we've said so often is that you're forgetting who the enemy is. The enemy is the virus. The enemy is not somebody who disagrees with what I want to do or what I feel should be done. The enemy is the virus, and it's just extraordinary how we've sort of lost sight of that in many sectors.
Dr. Grady, do you think that this is a moment in time, or is this a trajectory upon which we are headed as a world? You know, is there just these divisions that will continue to take place if, for example, there are future emerging pathogens which turn into pandemics?
I wish I knew the answer to that question. I mean, I do think it's certainly a moment in time in some respects because all of us were taken unaware, so to speak, even though we should have been prepared in some ways. I think there is a convergence of things that came together and got people divided in ways that is very unfortunate. Whether or not we'll return to some kind of togetherness in the future is an incredibly important question, and I don't know the answer to that. I sure hope so, because I can't see this continuing in this divisive way and coming to any satisfactory conclusion, whether it's about a pandemic or about anything else. I mean, it just feels torn apart a little bit.
I'm, as you probably know, Sanjay, I'm generally a cautious optimist about things, and I still hang on to the fact that I think we are going through a very unusual period in our country particularly, but spilling over for a little bit, for the rest of the world, that I have to believe, it just keeps me going with hope that ultimately the better angels are going to return as the dominant force here, and that we will come to a realization as a global community of why it's so important to put aside those kinds of things that have led us to this denial of reality and pushing back on things that are obviously for the benefit, and that we will return to a much more considerate approach towards the rest of the world. Again, I don't want to sound naive. I don't think I am naive. I'm a realist, but I just have an optimism that I think we'll get there.
You know, Dr. Fauci, it seems that people expect a certain certainty when it comes to science, right? They treat it like math sometimes. 2 + 2 = 4. Science should work the same way. Scientists know that that's not the way that it works. But is that part of what makes a pandemic like this ripe for misinformation and even disinformation? Oh, you didn't get it perfectly right, or it was then subsequently changed. Is that why misinformation can fester and grow?
I think you hit on something extremely important with that question, Sanjay, because I think it's a lack of appreciation. And maybe it's because as a broad society, we don't have a high degree of science literacy, and maybe that's the reason why we should be emphasizing STEM as we go along in the future. What is not fully appreciated is something that when you're in science, it's so natural, and that is that science is self-correcting, and science is seeking the truth, data, and evidence. And when you're with a pandemic, what you see on the first day isn't anywhere near what it ultimately turns out. And if you look at the history of what has happened during COVID-19, as we all know, it's gone from a new virus, maybe it's the old SARS, doesn't transmit very well, probably doesn't transmit at all very well. Well, oops, it does transmit very well. Not only does it transmit very well, it transmits better than anything we've ever seen besides measles. And guess what? Unlike anything we've seen before, 50 to 60% of the transmissions are from someone without symptoms, which means that anytime you want to get an arm around what's going on, 50% of the people are spreading it and you didn't even know about it. That took place between January 9th, when the virus was put on a public database, until somewhere in the middle and end of March. And yet there were many, many things that changed. So in that beginning, when we were talking about how the virus spreads, whether or not it was serious enough to lock down, whether or not you should wear a mask, all of those things changed because the virus information changed. It was evolving. So if, as a scientist, you don't evolve with the evolving situation, you're not being true to science, because if what we were going through was a static, then you should never change anything, because that would be flip-flopping. But if you actually change your perception of things, your recommendations, your guidelines, whatever you do, if you change with it, that's a good thing. And yet what's happened is that that's been interpreted by some as scientists don't know what they're talking about. One day they're telling you this, and the next day they're telling you the other thing, not realizing that we're evolving with a very much of an evolving real-time phenomenon, which happens to be the COVID-19 outbreak.
I think there's an additional issue here that's very much complementary to what you both have said. And that is probably because of the CNNs of the world and all of the information that people have, the public has paid more attention to science during this pandemic than maybe most other times. And so they learned things like what PCRs mean and things like that a lot of the public didn't know before. And so unfortunately comes with knowing about science and paying attention to science, a realization of how messy science can be and how uncertain it can be and how things do change over time. And as you said, for whatever reason, people want certainty. They want to know, what is it? What do I do about it? Tell me now, and don't change your mind. And that's not how science works. That's not how public health works.
I think a lot of this comes down to, it seems, just the issue of trust. It's messy. There's not certainty, but you have to have trust in science and in public health. And some of that trust has eroded over time, even prior to the pandemic. If you look at what was happening, there was some gradual erosion with authority in science, with public health. What beyond misinformation do you think are some of the reasons that trust has started to diminish?
I have a few ideas, and I'm sure Tony does too.
And maybe and are they legitimate as you answer the question?
Well, I think trust was tested because it appeared that we weren't as prepared for a pandemic as we thought we were or should have been. There was a lot of chaotic responses in the beginning. Testing was like, everybody said we should have testing, and testing wasn't available. There wasn't PPE for healthcare providers. I mean, there were so many things that went wrong in terms of how we first jumped into this. So the public health infrastructure had been decreased over the previous years. The pandemic preparedness wasn't as good as we thought it was. the messaging that came out of the federal government was kind of mixed and confusing. And I just think there were lots of things that made people say, can we trust any of this?
Yeah. And absolutely, I totally agree with what Christine said, but also there was mixed messaging that really whiplashed a lot of people. And, one of the things that, I think is unfortunate, but is true, is that, for example, when we were saying that, when the leader of the country was saying, it's going to go away like magic, it's going to disappear. And then you have public health people like myself saying, wait a minute, we really have a problem here. This is going to get worse. So people looking at the TV and they're going to say, wait a minute, who's right here? And then you have other people brought in who say that hydroxychloroquine really, really works. And then people say hydroxychloroquine, there's no evidence that it works. So I think you're asking people to make a judge like who's right. And it's a false equivalency. If one person says one thing and the other person says another, and you falsely make them equivalent, then your answer is you throw up your hands and say nobody knows what they're talking about. And that's one of the problems is the false equivalency of one person, because somebody says something based on no data, only anecdotal, and then someone comes in and says, wait a minute, there's no data that says this works. And then people who look at it, particularly people who don't pay intense intention to it, and say, I don't think anybody knows what they're talking about there. So just believe what you want to believe.
Yeah, it's very interesting, the perils of the democratization of information. I think information is a good thing, generally speaking, but there's a difference between information and knowledge. Information is plentiful, and it's very hard, as you point out, to distinguish what is good information, what is bad information, what is misinformation, what is disinformation. And I don't know if you saw any of the recent Facebook hearings, but something that really jumped out at me was that they are taking down billions of fake accounts. Billions of fake accounts. More than half the population of the world in terms of numbers of fake accounts. It's like if you go on social media, you're essentially entering Westworld. You don't know what is real and what is a bot. And that fuels a lot of this as well. But I guess one thing, Dr. Fauci, I'm just curious, and again, I'm not sure there's an answer to this, but what motivates this misinformation? Is this just to sow doubt? Is this just to create chaos? Like, if I'm searching for a new car on my computer and a bunch of Ford ads pop up, I get that. They're trying to sell me a Ford. But why try and get me to take something that's not proven versus something that is? What do you think is driving that?
To be totally honest with you, Sanjay, I don't fully understand it. I really don't. I think it has something to do with essentially making everybody's opinion equally valid. So therefore, my opinion is as good as anybody else in the world. Because what I've done is I've normalized misinformation. And that scares me. It scares me because it goes well beyond my own chosen field in life, which is public health and medicine and science. And it scares me that it's a threat to our democracy. It goes well beyond me. And I think one of the things that I hope we have, particularly the younger people, don't accept this normalization of misinformation. And it gets to that false equivalency that scares you, because when people are looking at it, they can't distinguish one with the other. You remember, and just take very briefly, because it sticks in my mind after decades. Remember in the early years of HIV, when Peter Duesberg, who was a member of the National Academy of Sciences, who was a very accomplished scientist, who said HIV doesn't cause AIDS. If you take drugs, it's the drugs that make you sick. Right. And I remember I had a very famous at the time debate with him on TV. And they had me in one screen and him in the other, Tony Fauci, National Academy of Scientists, well-known scientist. Peter Dursberg, National Academy of Scientists, well-known scientist. He says HIV doesn't exist. It doesn't cause AIDS. Fauci says it does. So half the people were saying, well, then why should I take a medication? I mean, that besides being extraordinary is, remember, the South Africans, Thabo Mbeki, bought into that and would not allow antiretrovirals for South Africans. And the estimate was that maybe 300,000 South Africans died because of that gap between drugs that were available and drugs that were allowed to be given to a country that was suffering. So it goes well beyond just he said, she said.
Right.
It costs
Repercussions.
lives, Sanjay. It costs lives. That's the thing that's so painful.
And in that case, you're talking about, for people who are watching that on television, you're talking about two National Academy of Scientists. Basically, in the layperson's mind, they have sort of equal footing, and they're hearing two very different things. There have been some terrible journal publications throughout this pandemic as well, suggesting things that simply were not true, maybe even retracted subsequently, but oftentimes the damage was done. What does this mean going forward? I mean, it does appear that there's a peer review process. There's a way that scientific literature gets out there. As a journalist, I'm often reporting on it, but I got to tell you, it's challenging because if bad science is getting published, it makes it really, really difficult, because naysayers will immediately say, here is this BMJ article. It says that vaccines cause myocarditis at a higher rate than COVID does. You're more likely to get sick from the vaccine than from the disease. What do we do about that as a scientific community?
Yeah, there's not a lot you can do with that. There really isn't, except, try and get particularly younger people as they're coming up to appreciate the importance of getting a critical evaluation of the literature. Because if you look at data, often those publications that really make a distortion of reality, if you look at it, the data doesn't say what they're saying. To me, you wonder why it even ever got published, but it does. Things get published right now. I think we need to turn the knob up on peer review.
Well, that's what I was going to say. We all, many of the people in this audience and some of us on this, we do peer review. So it's on us to make sure that we do rigorous peer review and make sure that things that don't make sense, that are not statistically sound, that are not, that the data don't show, are not published. They shouldn't be published. So it's on the peer reviewers, it's on the editors, the journals, it's on, all of us to make sure that the science that we publish is as high quality as possible.
Dr. Grady, I'm wondering, as over the last, nearly 2 years, as you're sitting around at dinner, in the few rare dinners that you probably get together, what sort of advice have you given your husband, Dr. Fauci, in terms of messaging, in terms of tone? What sort of things have you been telling him?
First, I tell him, eat. We have had some dinners. We do have dinner together most of the time, and sometimes it's very late, and they're intense conversations sometimes because there's a lot of serious things going on, right? But we've had conversations about, I remember I was thinking back recently to a conversation we had early on about the sort of consequences of telling people to stay home and what it would do for the economy. And there were a lot of people in those days who said, it's ruining the economy. It's much more important to just keep things going and not worry about transmitting virus. And I remember having this conversation, I don't know if you remember it, where I said, that one of the messages should be, how many lives are you willing to sacrifice? And that message would be pretty stark and pretty brutal, but that's really what the trade-off was. How many lives are you willing to sacrifice to have normal economic activity? And so we've had that kind of conversation over dinner. more than once, actually.
Yeah, I mean, but that sharpened my resolve to push forward with what I believe was the right solution. And it was really very advantageous, Sanjay, for me to have Christine, who, from her background and her experience in really core ethical principles, to really help me to really feel much more comfortable in what I was saying. Because you remember when certain individuals were saying, why don't we just let it rip? And ultimately, we're going to get to herd immunity. And then we'll be back on a good economic foundation and we could proceed. And at what price was that? And it was very clear. I mean, we've lost now 740 plus thousand people. Could you imagine if we just said those who will survive, survive, and those who won't? I mean, that's a terrible attitude, which still prevails. It still prevails. It prevails as recently as today. I saw an article about a couple of so-called scientists who were criticizing me for being one to say that, in fact, that's not the way we should approach it. You shouldn't just say, let it go and let people get infected and only pick out who you're going to be concerned about and let everybody else get infected so we could get herd immunity. A totally preposterous approach, which has been bought into by people with credentials that on face value, you would say they got pretty good credentials. They happen to not necessarily be public health people, but they got credentials in something.
Where is this inflection point, Dr. Fauci, between the role of experts, scientists, clinicians, ethicists, people who are experts in their field, and policymaking? I mean, what should the role of experts be when it comes to policymaking?
I think that you do need scientific expertise. And I always say that when people ask that, I always make sure people understand the difference between policy and politics. I mean, when you talk about policy, namely getting the information that you have and then make a decision about a public health tenet, like we're going to have a policy that we're going to do this based on this scientific data, which means that the role of scientists, the role of public health people in making policy is absolutely critical. You couldn't have that because they're the ones that are creating or analyzing and interpreting the data upon which policy is made.
But in addition, I think the experts have to use the data to inform policy, but they also have to be aware of the sort of needs and concerns of the public and try to somehow bring those into the equation when they're making policy. Not that they're making policy in order to satisfy the public necessarily, but they have to know what the needs and the concerns are. Otherwise, policy will be totally ineffective. And also experts have to be, some are pretty good at this and some are not so good at it.
Right.
They need to be able to communicate in terms that people can understand what the policy is, why it's justified, how it'll impact people's lives.
You know, Sanjay, I couldn't help but be thinking when Christine was explaining that about attention to the needs of society, it harkens back to the years that you remember when I finally realized, I hope pretty quickly, when I was confronted by the AIDS activists, that there were policies that the science said you should do A, B, C, and D for pure science, make the policy. This is the way we're going to run a clinical trial. This is the way we're going to regulate the drugs. This is the way we're going to do this. And when Christine just said that, it brought me back to saying, yes, but you got to pay attention to the needs of the people that are impacted by your policy. And one of the great advances and aha moments I had back in the late 80s was when the activists taught me that, okay, you got the science, okay, you're making a policy, but I'm the one that's in risk. I'm the one that's sick. I'm the one that's dying. You can't ignore the impact of your policy on me. So when Christine reminded me of that the other night, when we were discussing it, I had this flashback of how I first became aware of that very important concept.
I'm curious, when you guys have these dinners, is there ever a time when you don't agree on something? If you disagree, I mean, how do you then handle that?
Oh, sure, there are things we disagree on, but not too much, not too many fundamental concepts, actually. We're pretty aligned in terms of our core beliefs, I think.
Sounds like it. And Dr. Grady, with this particular pandemic, from an ethics standpoint, is there some lessons you think we can take forward? And I'll just I'll just say that even if you go back and look at the 1918 flu pandemic, there were people who were anti-maskers back then. Part of me wonders, should we just always sort of anticipate that there's going to be people who are going to be anti-fill in the blank, anti-mask, anti-vax, whatever it is, instead of trying to get every single last person. And I want to be careful in how I frame this, because I think it's important to be very consistent in messaging, but it does seem that there's always people who are going to be very skeptical, very suspicious, very unlikely to follow the advice and the guidance given by experts. What lesson does this mean
what's
going
interesting
forward?
about that, I think there are people who are going to be resistant to information no matter what, or to reliable information, let's put it that way. But there's a lot of people in the sort of center, if I don't know if center is the right word. There are a lot of people who are just plain confused. And they're confused because of the things that we've been talking about, the kinds of misinformation and disinformation. And I think it's on all of us to be patient with people and to try to explain to people, or respond to their questions, respond to their concerns. I'll give you one example. I get a ton of emails. I'm sure everybody else does. I got an email not too long ago from a guy who said, I'm pretty healthy. I don't think I need the vaccine. I don't know where to get information anyway, and whatever. So I wrote back to him, and a long email with, here's where you can get information about what's in the vaccines, why you should get vaccinated, where you can get them. Here's some, information to counter the myths that you might be hearing about. Here's why you should get vaccinated. It's good for you. It's good for the people around you. It's good for, and I spent some time on this email. He wrote back to me and said, no one has ever answered me before, and I'm going to get vaccinated. Now that's one person, but the example of that is, there are people out there who really don't know how to find information, who don't know what to believe. And all of us can provide some, can talk to people that we encounter and help them. The other thing I think, Sanjay, you asked what, going forward. I think we need to think of ways to better instill in all of us the responsibility that we have to others. We live in a world that's connected. We're connected to the people we see every day, but we're connected to people all across the world. And I don't know why we don't always appreciate that responsibility, that everything we do has an impact on somebody else. And that's something we need to teach our kids, need to teach everybody all along the way, and exemplify it.
I think that's a very important point. I have a lot of questions, but we're getting so many questions from the audience as well. Let me take a few of these if I can. This one's from Jerry Sawicki. Dr. Fauci, I'll ask you this one. It says, since we are not likely to reach herd immunity with all the vaccine resistance in our country, what is the plan for living with endemicity, being endemic? What's that going to look like?
I think it's going to really be shaped by what proportion of population now, the 64 million people who are eligible for vaccination who've not been vaccinated. If you have a proportion that isn't even close to getting a blanket of protection, then we very likely will have a level of smoldering infection that, you know, when I look at infection, Sanjay, you look at pandemic, you look at deflection of cases, control, elimination, eradication. We've only eradicated one virus, smallpox. We have eliminated several in different countries. In this country, we've eliminated polio, we've eliminated measles, except for an occasional burst of cases, usually in a community, an enclosed community that's undervaccinated. To me, the endemicity has a range. You can be endemic with a couple of blips of a few cases, or you could have endemic where it continues to impact society and what you do. I would hope that we get low enough in the endemicity that it really doesn't impact you in the sense of interfering with the normal things we like to do. I don't think we are going to eliminate it. I mean, that's one of the things that was in the first week or two when we knew it was a coronavirus. We said, hey, we've dealt with that before. We had SARS-1. Right. We took care of it with public health and it went away. This is not SARS-1. This is a very, very different virus. And it's going to be up to us. And that's the reason why, you know, related to the question you just asked, Christine, to get those recalcitrant people to not be pejorative about you're bad because you're not getting vaccinated, but to do a bit more of what Christine did with that lengthy, time-consuming email she sent to people. We've got to not give up on people. We've got to get trusted messengers. We've got to appeal to their concern for society, including their family. Otherwise, endemicity has got a big range. It could be here or it could be here. If it's here, we're in trouble.
Let me throw this next question to you, Dr. Grady. This one is from Kashifia on Zoom, asks about the ethical dilemma of religious exemptions for the COVID-19 vaccine. What kind of scenarios would make that sort of exemption not acceptable? Should religious exemptions always be on the table?
So I think the questioner might even know this. This is a hot topic of controversy right now. There are, of course, in many places, mandates for vaccines for employees of different kinds of facilities, healthcare workers, for example. That's probably what I know the most about. And most places, because of EEOC rules, have an option for religious exemptions. But one of the things that people are trying to figure out right now is, what does that look like in the setting of COVID? I think that institutions are trying to set up mechanisms for reviewing applications for religious exemptions and et cetera. I think there probably is a reason to allow religious exemptions in this case, in the case of vaccine mandates for COVID. But I do think that, for example, in the healthcare scenario, if somebody is not vaccinated and gets a religious exemption from vaccination, then their responsibilities, their patient-facing responsibilities, should be limited, and because it's dangerous to the patients.
Yeah. You know, when you look, Sanjay, at the reality, there are precious few religions which explicitly say you shouldn't get vaccinated, and yet a person can decide. I mean, I've spoken to people who say it's against my religious beliefs, but you ask them what religion they're in, and you've never heard of anything in their religion, in the tenets of their religion. So there's this fine line between a philosophical objection and a religious objection. And there are people who go online and create their own religion and say, this is my religion, and therefore I'm not going to do it. So, I mean, you must respect bona fide religious objections. Absolutely, you've got to do that. But you've got to make sure it doesn't completely get out of hand where everybody, for one reason or other, creates this illusion that it's a religious objection when it isn't.
Right. And I think many people who follow this topic should go ahead and look at Pope Francis' comments on this as well, because there has been these comments from the Vatican. This question is from Alex Lynn, Dr. Fauci. Some lessons that the United States may have learned from other countries with regard to an effective COVID-19 response. And I'll preface by saying, prior to the pandemic, the United States was listed as likely to be the most prepared country in the world to handle a pandemic. That aside, are there certain countries that you sort of look to and say they were particularly effective over the last couple of years?
Yes, there are, but there are variables that confound it. I will answer your question in a second, but I just want to say that if all countries were the same size, the same culture, the same geographic surrounding, then you could really do a good comparison if they did it well and they didn't do it well. But you have countries that are islands, New Zealand, Australia. You have countries in which the societal acceptance of authority is much, much different than in the United States. I mean, you go to Singapore, you go to places like that,
Right.
when the government says this, that's it, it gets done. So there are countries that have done better than we have, considerably better than we have. And, Taiwan, Australia at first, and then New Zealand, and then Singapore, and then others. But the fact is that we were voted by the Hopkins School of Public Health as being the best prepared for a pandemic before the pandemic occurred. So we were the best prepared until we weren't the best prepared. And that's just why it's so difficult to say that there are so many factors that go into it. And we touched on a few of them, Sanjay, that I'm particularly disturbed by. And that has to do with the degree of divisiveness that we have in this country, which absolutely is a total contraindication for a good response from a public health standpoint. So, Chris, I'm
Well,
sorry.
I was just going to say there are a couple of things that I think we did well. Some of the science has been quite extraordinary. The fact that, and we are not the only country that was involved in developing vaccines, but certainly, we have vaccines that are incredibly safe and efficacious and widely distributed in sort of breathtaking speed. So that's pretty remarkable. There are other things we could have done much better, like getting tests available for people. I mean, even today, it's hard to find a test sometimes. And I understand in other countries or some other countries, you can find a test like that and get results in 15 minutes. And here it takes a longer time.
We're getting better with testing, though.
We're getting, say that for 2 years.
No, we are responding. No, you're absolutely right, Sanjay. We spoke about that early on, was the missteps in testing, that we really could have done much better than that. The realization that we have left our local public health infrastructure to have a degree of attrition was unacceptable, and was probably we were victims of our own success with the successes we've had with vaccines, until you needed a strong local public health infrastructure to do the kind of identification, isolation, and contact tracing. We didn't realize until we were knee deep in it that we weren't nearly as prepared as we should have been.
It was very interesting. I was in Tokyo for a little bit during the Olympics, covering the impact of COVID on the Olympics. And you're right, you could go to essentially what looked like a vending machine, buy a test, take your test, and have results within about a half an hour. It's kind of incredible. Lots of questions coming in that are sort of at this inflection point between public health and ethics, some of which we've talked about. The response to vaccine and mask mandates, is that Western autonomy? Did collectivist communities in other countries do it better? But there's a specific question, Dr. Grady, about the ethical considerations of physicians and nurses refusing to take the COVID-19 vaccine. People who work in hospitals, who may be taking care of vulnerable patients. How do you think of this?
Well, I think that physicians and nurses have a responsibility to be as informed as they can be about vaccines and about everything, but they're involved with, but certainly about vaccines as well. I do think that physicians and nurses have, they're people too. They get to make a choice. The problem is if they make the choice to not be vaccinated, then there's certain jobs that they can't have. And I think that's legitimate because it protects the patients. And so if a physician or a nurse wants to decide not to be vaccinated, they have that privilege, but they can't necessarily do the job. They can't work in an ICU. They can't take care of patients because patients are at risk because they are not vaccinated.
Dr. Fauci, what do you, I mean, you've heard these stories about nurses and doctors, not getting vaccinated, even losing their jobs as a result of that. I was surprised by that. I mean, you've chosen healthcare as your field. People have dealt with vaccines, and many of these people have gotten other vaccines, I'm sure, throughout their lives. Is it the same issue? Is it the politicalization of this that is really driving this, do you think?
I think the answer is partly yes, but it's even more puzzling because as part of your fundamental mission in life is to help people in the realm of health, to prevent disease, to treat disease. And in those people, and I want to be careful because I don't want to be pejorative about it. I would love to be able to sit down and have a conversation on an individual basis with people as opposed to grouping them all in one group, because I think that's unfair. But I think if you take a prototype of that, I would like to be able to sit down and say, let's examine your motivation. If your motivation is you don't want to be told what you should be doing, well, that's understandable. But remember, your primary purpose in life is to help people in the realm of health, to prevent and to treat disease. So you have an intrinsic contradiction there that you got to explain to me. And I would just like to hear what that explanation is, because Sanjay, I don't think there is an explanation. I think what they've done is that they've left their inherent feeling of, I'm not going to do what somebody tells me to do because I don't want anybody to tell me what to do. They are letting that spill over into what should be their core principles that they go by. And that's why I agree with Chris. If in fact this core principle interferes with this one, then go find something else to do with your life because you've made the wrong choice.
I had a long conversation with a nurse, Andrea Babinski in Wisconsin, and it's exactly what you said. I mean, fundamentally, it wasn't that she didn't understand the science. It wasn't that she didn't believe in the efficacy. It was the mandate part of this that really was something that she was sort of, making her reluctant. But along those lines, this question from Julianne Ferguson: how much vaccine hesitancy do you think is caused by the mistrust of the pharmaceutical industry as opposed to mistrust of public health experts? Again, even before this pandemic, there has been mistrust of the pharmaceutical industry, Dr. Fauci. I mean, I don't know there's an exact answer to this, but how much do you think of the just overall mistrust in pharma is driving this?
I think there is a component of it. I don't think I can give you an accurate percentage of it, Sanjay, but I think it's real. It's real. And I think the reason it's real is because there is this impression, sometimes justified, that the companies are doing things purely for the standpoint of wanting to make a lot of money. And that has to do with the pricing of interventions, not just vaccines, but all interventions, as well as the fact that it appears that they fight very, very strongly for keeping their own intellectual property and not wanting to share it, for example, with the low and middle income countries. There is a perception, not all companies are that way, but you would think right now that there is this mistrust because they're feeling that the only thing they're interested in is making a profit. So therefore, if you're only interested in making a profit, then how can I trust what you're saying? How can I trust you telling me your vaccine works? How can I trust you telling me your vaccine is safe when all you want to do is make money? So I don't know that that's 80% of it, but that is a percentage of why people push back. Chris, you were going to say something.
Well, I
I'm
just
sorry.
think that it's interesting that the many surveys that have been done asking people why they don't want to be vaccinated, that hasn't been a huge reason. It's been on the list, but it's not been a huge contributing reason. Most of the reasons are fear of side effects, worry about that it happened too fast, and lack of understanding of the data of how a vaccine works and how it protects me. Those are the reasons people give.
Yeah.
We have just a few minutes left, and I got to tell you, there's just so many questions coming in from students, and I want to. They're great questions, and many of them are basically asking. They're from people who are interested in entering public health, the medical field, entering bioethics, and basically asking some version of the same questions. Would you still recommend that they do so? Is this a good career choice? Would you do it again if you had to do it all over again?
Yes.
Overwhelmingly, Sanjay, overwhelmingly. I mean, public health and medicine and science isn't for everyone, for sure, and it would not be suited for everyone. But if you have the slightest inclination and you're thinking about it, the gratification that you can get out of doing something that is so precious to people, their health and their lives of themselves and their family. To me, I say this, semi tongue in cheek, but I mean it, is that I would do it for nothing. If you just gave me enough just to eat and sleep, I would do it. And I mean that very sincerely. I mean, to me, it's that meaningful enough. And there aren't a lot of professions like that. I mean, again, I'm sure there's gratification and important contributions in so many different professions. But if you're thinking about it, don't be dissuaded and don't be put aback by some of the difficulties that you and I and Christine have been talking about tonight.
Right.
Because the positive aspect of it overwhelmingly outweighs any negative aspect.
Yeah, I would say the same thing about bioethics. And not only is it gratifying, but everybody is interested in some of the issues that bioethics grapples with. And it's an intellectually rigorous and exciting place to be working, even though some of the questions don't have, they're hard to answer. They don't have good answers. It's really it's a great place to work.
Yeah, I would, for what it's worth, I would third that as well. I mean, I have 3 teenage children myself, 3 daughters, just like you do. And I get this question from them and entering medicine and public health, and I would overwhelmingly recommend it. I'm curious, just in the last couple of minutes, Dr. Fauci, what clues do we have about what will ultimately happen over the next few months? I was showing some data recently from 2009 pandemic and even the 1918 pandemic, looking at these different waves and seeing a similar wave happen in both those pandemics right around this time of the year. After this surge in 2009, the numbers went down and they sort of stayed down. In 1919, there was another surge, a much smaller one in the spring of 1919. Crystal ball, what do you think is going to happen over the next few months?
Well, we are on a down slope. And the thing that is a challenge for us is to keep that slope going down. Because if we go down, we were way up there at a couple of 100,000 cases per day, then we went down and down and down. So now we're at about 70,000 per day. We've got to keep the deflection going down. And that's going to be challenging because we're entering the winter season. There will be much more indoors. People understand because they see it going down. They may relax a bit on mitigation. Even vaccinated people may do that. They may be in indoor congregate settings where they don't know the status of people who are with them and say, why should I wear a mask? That's the reason why the CDC says, let's wear a mask even indoors, even if you're vaccinated, because you don't know when you're in a congregate setting. That should not be confused with what we've been saying, that if you're vaccinated, enjoy the family, be with your family, be with your close friends and enjoy it. But be careful when you're out in unfamiliar places, particularly indoor. It's a little bit more long-winded. What I want to say is that I don't know what's going to happen. I believe that we can go straight down to a low level. That's what my optimistic pulling for is. Keep getting people vaccinated, keep mitigating until you get to such a low level that it's no longer a threat. So what we need to pay attention to is what happens in the next few weeks, because as we go down and we sort of start to see a plateau, then we might be in trouble. I hope we don't see that, Sanjay. I hope we don't, but it's going to be a challenge.
And I remember you telling me once, it's an arbitrary number to some extent, but fewer than 10,000 cases per day would sort of feel like have some sense of control.
Yeah, I believe I'd like to see it much, much less, but we've got to get down to that. It's an empiric number, and you're going to get the people who contradict everything I say is going to say that's a wrong number, but at least down to that level. We can't plateau, Sanjay, at 70,000. We know what that means. That means there's enough of a dynamic of virus in the community that you are going to have mutations. You have the risk of another variant. We've got to get much lower than that. We can't be hanging around 70,000 new cases a day.
Well, I thank you both for your time, for all the incredible work that you've done, for your service over so many decades now, and for the privilege of speaking to you tonight. I really, really appreciate it. I look forward to these conversations more than any other, seriously. So I just hope we can do it in person again sometime soon. That's what I would really like.
So. And you often said, as I've told you in last time we spoke, you ask what we talk about over dinner. Well, I'm looking forward to the time when you and I and your wife and Chris and I will be able to talk about this over dinner. I really do look forward to that.
Well, here's to that. And thank you so much. And thank you to the foundation for having us tonight, and for everyone participating in all the wonderful questions. Thanks for joining us. That's a wrap.
Thank you very much.
Thank you very much, Sanjay.
Thank you.